and we can move on to the next around the room.
Sure, next around the room, and we're not in our usual location because we're having technical difficulties with the Polycom system, so you're not all up on the big screen, so you're on the little screen. Next is Melissa Bauer, and I can hold off on introducing you because you're going to give us the whole review of the data that's been analyzed. So if it's okay with you, we'll hold off and introduce you more formally.
Sure.
And then I have Pam. Hello there.
Good morning. My name is Pamela Mitzi. I am the director of the Long Island Prevention Resource Center. We're funded by the State Office of Addiction Services and Supports, and we cover Nassau and Suffolk counties. Happy to be here.
Melissa Thornton.
Hi, everybody. My name is Melissa Thornton. I'm a MPH student at Stony Brook University. I graduate this spring, and I have a huge interest in community health at Suffolk County.
Welcome. Christine Duffy.
Good morning, everyone. I'm Chris from St. Mary's Healthcare System for Children. We work with medically fragile population and serve the 5 boroughs, Nassau and Suffolk, and we recently joined the Healy as a providing company working with the 115 waiver out in Nassau and Suffolk.
Good. Hi, Gary.
Hey, how are you?
I'm good. How are you? Long time no see.
I know it's been a while. Well, let me introduce myself. My name is Gary Carpenter. I'm president of my corporation, Gary Carpenter and Associates. We represent home health throughout the state of New York. Basically, I represent one of the biggest also companion care agencies on Long Island, Helping Hearts at Home, which is in Smithtown. So we're very big supporters of your organization. But anyway, that's who I am.
Thank you, Gary. I'm not sure about this next identification I have on the screen. It says Firefly. I think it's artificial intelligence. I'm not sure who.
That is me. That's Greta Gorton.
Oh, hi, Greta.
Hi. That's my note taker. Firefly.
Oh,
okay. Which is a good thing because it shows up 3 minutes before a meeting starts. When I show up 8 minutes after, I still caught the beginning. So I apologize for that, but it's.
Oh, okay. Okay. Well, welcome, Greta. Greta,
Thank you.
You're with the Long Island Coalition.
Long Island Coalition for the Homeless.
Yeah. And I have Karen. Oh, wait, Lucy Kenny. Oh, wait, Nadine. Let me do Lucy Kenny and then I'll go back to Nadine.
Lucy. Hi, I'm Lucy Kenny. I am from Stony Brook University Hospital, Department of Planning. I'm a Special Projects Associate, and I work on public health projects as well as grant writing.
Wonderful. Nadine Vilches, welcome.
Thank you. I'm Nadine Vilches. I'm the CEO and founder of Mind Dark Health. We have a data-driven prevention model and software that reduces risks of mental and behavioral health disorders through a positive psychology approach to community mental health.
And Karen Kirschbaum. Well, I know she's there. Maybe she's on the phone or something. All right, so we'll come back to Karen. Dr. Mermelstein, Linda Mermelstein.
And thank you very much. I'm Linda Mermelstein. I'm Associate Director for Community Outreach and Engagement at Stony Brook Cancer Center. Thanks for having me.
Sure. Chris Hendricks.
Hi, I'm Chris Hendricks. I'm the Assistant Vice President for Community Outreach for Catholic Health.
And Claudia Alahi.
Hi, everyone. I'm Claudia Alahi. I'm the System Community Outreach Manager at Catholic Health.
Sarah Narcisse.
Hi, I'm Sarah Narcisse. I work at Nassau County Department of Health's Office of Epidemiology.
Welcome. Sue McCabe. Oh, maybe Sue is on another call. Okay, oh, there she is. Sue? No, okay. Dr. Tavor Buckman.
Good morning. I'm Tavor Buckman. I'm Director of Epi at Nassau County Department of Health.
Marissa Ryan.
Good morning. My name is Marissa Ryan. I work at the Nassau County Department of Health in the Office of Epidemiology, Biostatistics, and Planning.
Mary Emerton.
Good morning. I am actually joining Healy in a role for the Social Care Network starting Monday.
Okay, very good. Selena Cabello.
Good morning, everybody. This is Selena from the Nassau County Department of Health, and I also work in the Office of Epi.
Analia Trask.
Good morning. I'm Analia Trask, and I'm a program coordinator for the Stony Brook Cancer Center Office of Community Outreach and Engagement.
Very good. And Kelly DeVito.
Good morning, everyone. Kelly DeVito from Horizons Counseling and Education Center.
Alana Jenkins.
Good morning, everybody. I also work at Nassau County Department of Health in the Epi Biostats and Planning unit.
Welcome. I hope I get this name correct. Pham.
Good morning, everybody. My name is Tan Pham, Community Specialist at Outreach Development Corporation, Substance Use and Mental Health Treatment.
Hi, welcome. Dr. Daniel Craig.
Hello, good morning. I'm Dr. Danielle Craig, and I am Medical Program Admin for Suffolk County Department of Health.
Okay, and I know Karen Kirschbaum from Western Suffolk BOCES was having trouble with her microphone. So Karen, you want to quick introduce yourself? And there was somebody else, oh, Sue McCabe.
Oh, yes. I even got my camera going too. Sorry, I missed it before. Good morning, everybody. Dr. Karen Kirschbaum at Western Suffolk BOCES. I am the School Community Wellness Coordinator under the New York State Department of Health grant Creating Healthy Schools and Communities in towns of Babylon, Islip, and Hempstead. Good morning.
Good morning, Karen. And Sue McCabe.
Good morning, everyone. My name is Susan McCabe. I am a nurse practitioner and PhD candidate at Medical University of South Carolina.
Oh. Okay. Now, did I miss anyone?
I'm not sure if we heard from Christine Duffy.
Yeah, no, she did.
Oh, sorry.
Yeah.
Okay.
Right,
I don't think we
Christine
heard everyone.
Duffy? Yeah.
Yes,
Okay.
thank you. St. Mary's Children.
Yeah.
Thank you.
I think we got everyone.
All right.
All right. So what are we going to do today? We're going to do a lot. And the first thing that we're going to do, you can see the agenda here, is hear from Melissa Bauer, who is the Principal Healthcare Informatics Analyst at DataGen, which is a healthcare analytics organization that the collaborative has worked with for many years. Melissa is a whiz in terms of her ability to analyze the data and then help visualize it in ways that we who are non-data people can easily understand. And what she's going to show us today are the analysis from the 2024 Community Health Assessment Survey, which is the survey that goes to individuals. The public survey goes to individuals in Nassau and Suffolk County. We thank all of you who have been helping to push out that survey and continue to push it out now for this year's collection as well, through all types of channels, because that's the only way, because we use a convenient sampling method, that we can get responses. In addition to what we do here at the collaborative in terms of our social media posting and all of that. So I'm going to turn it over to Melissa, and she's going to give us the report on what the community feels is their greatest health needs and concerns.
Thank you so much, Janine, and good morning, everyone. I'm going to just share my screen so you can actually see what I'm talking about. And turn off my video because my bandwidth is never happy. Okay, So as Janine said, this is the data from the 2024 CHAS Community Health Assessment Survey. And it is a pretty robust report. It is in a Power Pivot model that is in Excel. And while we have the general data, which would be all of the surveys we received from January to December, we're going to focus on Nassau and Suffolk County today. So there were a total of 363 surveys that we received back from Nassau County. Primarily, interestingly enough, men responded to the survey. This is an anomaly from what we have seen in the past. It's usually mostly women responding. And when I look at your data, I can see that, as I expected, 37% of the population from Nassau County, of the respondents from Nassau County were age 65 and plus. And this is something that we do find when we receive these types of surveys back over time. Most of the time we do see women that are 65 plus, but I did find it interesting that men edged out women in responding this cycle. We asked a lot of what I would consider demographic characteristic questions. And so that's what we're looking at here. You can see that primarily people in Nassau County had a household income of over $125,000. That's at 45%. Most of the respondents, because they are 65 plus, are retired, but we did have a good batch of those that are employed for wages and self-employed. Primarily, we had white respondents. Secondary, we had multiracial and Black African American. I know I'm skipping around, and please, if you have a question or you would like to speak about something, feel free to interrupt me or jump in. I'm happy to take questions on the fly as we go. Most of the people that responded in Nassau County did have insurance, 97% of respondents. And those that had insurance, most of them had private commercial, 76%. And the education level of the respondents, 31% had a college graduate, were college graduates, followed by 27%, which had completed graduate school. And then the last demographic style question was if people had a smartphone or reliable internet. It's a combination of the two questions because the survey did change midstream. And so we'll also go over the information for Suffolk County. For Suffolk County, we had 509 respondents, and 68% of those were women. We had a little bit more of an equal distribution of the age ranges, and the largest were in that 45 to 54 group, which is interesting for the survey responses for Suffolk County. It's a little bit different of a demographic than we're usually able to capture, which is nice to have. Income for households in Suffolk County, 35% were in a over 125,000 bracket. So similar to Nassau. And then 44% of our population here was employed for wages, which fits kind of with what we would expect with that age bracket. We did have a little bit more information on multiracial, other, and Black African American races, but primarily 81% of the respondents were white. And insurance, 86% do have insurance, and that insurance is between private commercial and then Medicaid, Medicare split, but 59% were private commercial. And of the respondents, 39% were college graduates, 20% had some college. And then for the smartphone internet question, kind of what we expected, 98% for that. And then last year, I had a question from one of the attendees at this meeting, if we could add that information into a table that we could look at by zip code. So that's this table that you'll find here, where you're going to be able to click on your county and then look at the zip codes underneath that county to be able to see the total respondents per each zip code, and then what their gender identity, ethnicity, race, etc. are. And the first time I select something in this drop down, it takes a minute to kind of populate. And because we ask these questions kind of open-ended, you'll see there's some weird responses in here. People do tend to type strange things into their surveys, but we did do the best that we could separating out by zip code. And so these tables work similarly. These are filters or slicers. And so you'll be able to look at all of the information by zip code and by all of that other demographic style information. So you'll be able to select, if you wanted to look at the populations that had a different income, or if you wanted to look at just those that are Hispanic, Latino, you'll be able to do that in the report. And that is for all of the questions. So what are the biggest ongoing health concerns in the community you live in or for yourself, and what prevents you and your family from getting medical treatment, etc. And so all of that information is in these tables here. And so what we've done is kind of distilled that information down into rankings. And so there are Nassau rank and Suffolk rank tables within the model. And additionally, there is a report, which I'll show you in just a moment, that shows them side by side. But what we did was we ranked them from the top 5 for each of the questions. And then we give the adjusted value and the percentage that we received for each of those. And so they're all in order. So you can see, cancer for Nassau County is, according to the residents, the biggest health concern in the communities where they live. Heart disease and stroke for Nassau County is the biggest ongoing concern for oneself in that community. People in Nassau say that there are no barriers. That's quite a lot, 69%, a little bit over 69% prevent people.
Wow.
Yeah,
Wow.
I know.
That's amazing.
It is amazing because it is something that we've not seen.
Never seen that.
Never. Yep. So
Wow.
this is a very interesting round of this data, and I've done this for several years. And it was such an anomaly that I went back and I checked 3 times because it just was, it does not seem to me that that was accurate, but it indeed is. So the people in Nassau also said the following, which is clean air and health is the most important to improve the health of their communities, which I also found interesting. And then the respondents chose cancer as a screening or resource needed in their community as the top one. And then most people, I'm glad to see this, are choosing doctors and health professionals where they get their health information, which is nice, followed by the internet, which is only at 45% for that ranking. And then for Suffolk County, people chose cancer, which is the same as Nassau County, for the biggest ongoing health concern in the community where they live. And a little bit different for, excuse me, for Suffolk County is that they chose obesity and weight loss as their biggest health concern for themselves. And Suffolk County chose there are no barriers as well. 44%, a smaller percentage than Nassau, but still are saying that there are no barriers. And then second to that is unable to pay copays or deductibles. Similar to Nassau County, healthier food choices is the most needed. I usually, sorry, not similar to Nassau County. What I found interesting here was that they wanted cancer information to improve the, clean air and water. And Suffolk County chose healthier food choices. It's still in the list, but healthier food choices edged it out by just a little bit. And then this one, similar to Nassau County, wanted cancer screenings and information to as resources for their community. And so we've also compiled this report, which I believe Janine posts to the site, and it gives, you know, how we created the data, the weighting system that we use, which is, you know, a weighted response, because we do allow respondents to choose more than one answer for the questions. So we did weight that to kind of distribute the information so that it's more digestible and accurate. And so you can kind of see the ranks against one another in this table set here. And so that is the report. It's in its entirety, but I would love to answer any questions that you might have.
I have a quick question. Hi, my name is Gabriella. I'm the Director of Epidemiology and Public Health Analytics at Catholic Health.
Sure.
Do you plan on kind of stratifying these questions by the demographic characteristics? Because most likely the reason there's no identified barriers is that the sample is primarily individuals who have higher incomes, who are educated, who have health insurance. So those.
Yes. And so that is what these little these are the questions. And so you absolutely can do that. So if you wanted to look at, you know, what prevents you and your family from getting medical treatment, these are the answers in this tab here. So cultural, religious beliefs, don't know how to find doctors, there are no barriers. And what you're going to be able to do in this model is you can select Hispanic or Latino and see the answers down at the bottom. It's going to be the answers for that.
So Gabriella, this is a power pivot table that you can go in and slice and dice the data any way that you want to. I would just want to point out that the no barriers response is a complete anomaly that we have never seen before. And I don't know that it's just related to income, that because of how many years we've been doing this. But maybe Melissa, just kind of give a quick demo of how they would.
So I just
say go by maybe by ethnicity, and in that particular question, you can choose. What you would do is choose the zip codes of your service area, I suppose, or you could look at all the zip codes, and you could see, get a more granular look at what the responses are for those particular zip codes.
Sure. So Gabriella, I chose Suffolk County, so how it's in blue and the rest of them are white. That tells me that that filter has been applied. You can also tell by this little funnel here, if there's an X on it, it means that the filter has been applied. And then I also chose Hispanic or Latino. And so I'm interested to know what they responded to. There are no barriers. So if I look down at the very bottom, I can see that their grand total is 15.75, but I can also see that no insurance, if I hover over it, no insurance is at 42.50. So I can kind of look through these responses to see. So 98 people responded, and this is the weighted count in this grand total. And it looks to me like no insurance for the Hispanic Latino and unable to pay copays deductibles are the top two, with the no insurance being the top, but it looks like third for them would be there are no barriers at 15.
Those are the numbers, not the percentages, correct?
These are weighted totals.
Melissa, hi, it's Tabora Buckman from Nassau County. How are you?
Good, Tabora, how are you?
Good. Thank you for the information. The last community health assessment, we included data from 2021. So for our upcoming assessment, is it possible for you to combine 22, 23, and 24 together, so we have a larger sample size and a more representation?
I mean, that's certainly something that we could do. That would be a discussion contract-wise between Nassau-Suffolk, the collaborative, and DataGen.
So let me offer this another alternative. is if you're unable to do it because of contractual engagement requirements and money, funding, would you be able to provide to us the raw data and we'll do it?
So lovely enough, I give you the raw data.
It's
And
on
all
our
of
site.
For
Yeah,
all the years? I want it for 22, 23, 24.
it's on there.
it's
Okay.
all in here. So if you right click and choose unhide,
Yeah,
there's
we can.
all data and then all of the quarters. So each
So-
of the models that you should already have
Yeah.
will include all of that data.
So this is for, obviously you're showing us 24 and there's 23 and 22 are somewhere on our menu, our membership menu somewhere. It's not on this spreadsheet, correct?
No, it is not. They're all done by year in each individual spreadsheet, but I did do an analysis for each of those years. So if it's not available on your drop-down site, definitely contact Janine and I'm sure she can
Okay,
provide.
terrific, because we can do that. So let us know. I mean, obviously it'd be great if you could do it, but if you can't do it, Janine, no pressure, we'll do it.
Okay.
Thank you. We're gonna add it together because we want a larger sample size as best as we can.
Can I just
Well,
ask,
that makes
how are
sense.
you gonna make this available to us? Because I know in the past when I was working at the health department, I had difficulty opening the document.
You've had difficulty opening which document?
Like the past reports of this, I could never open the spreadsheet. And so I'm just wondering, is this gonna be posted on the website? Or are you emailing it to members or how are you getting this done?
Well, it will be posted on the site, but we can also email this to you. You don't have trouble now? That was when you were at the county, are you saying?
Yeah, I don't know yet.
I don't think the county had the I don't think the county had the updated Excel or something like that, if I recall.
Yeah. So you need to be running at least Microsoft 2013 to be able to view the model. And that is for we're unable to create the model in older versions of Microsoft for security reasons.
Yeah.
Danielle, you're at the county health department now. Do you know if you have that version?
We do have that version, but I think the other reason that we can't open stuff at the county is because of the all the security after the cyber issue a couple of years ago. So usually when I need stuff, I have to ask Brooke to just send it to me email version because I can't go on the website and click it and pop up. It won't let me do that on our system.
Okay, so
And we can certainly do that. So yes, this report and the summary report will be available at the webpage that I just dropped into the chat after the meeting, and all of the previous analyses are there as well. So if you would like it, emailed to you individually, we can absolutely do that.
Yeah, Brooke, can you just individually email me this one and then the previous 2 years as they were talking about earlier to do combined analysis?
And if anybody else would like to receive it that way, if you could just please shoot an email or drop a note in the chat, that would be really helpful. Thank you so much.
but Linda, you're able to open at Stony Brook now, though. Yes?
I'm not sure. I have to try that.
All right. Well, if you can't, just let us know. If anybody has trouble, just let us know. But okay, additional years of data as well. Gabriella wants that as well.
And so that's all publicly available on the site now.
Yeah, it's all publicly available. It's all
On
there.
that page.
What was I going to say? I just had a thought I was going to ask. I can't remember now what it was. I got sidetracked. Can't remember.
Yes, I'm able to.
Is everyone that's on the call familiar with, or at least have some facility to use Power Pivot Excel if you wanted to look at a certain groups of zip codes or whatnot? Or would you like Melissa to give a quick demo on that?
I think, speaking for myself, I'm Lucy Kenny from Stony Brook. I'm familiar with it. And I also wanted to ask Melissa a couple of other questions.
Sure.
First of all, these results are not generalizable to the larger population, correct? Because of it's not a random sample.
Not a random
It's
sample.
not a random sample. It's a
So-
convenience sample.
Yeah.
We never have enough money to do a random sample.
Right. So, Melissa, did you look at how the demographic breakdown of the respondents compares to the demographic composition of the counties? And how, how close it was and how not close it
No,
was?
I did not do that for each of the, ethnicities or races. We did it for overall counts. And it is a count wise, the number of responses we got is appropriate sample size. But because we did not do it by race, ethnicity, age, things like that. We can't tell you it's an accurate representation of the percentages of those populations. Does that make sense?
Yeah, or
It's
the-
not an accurate representation.
right. And when you refer to weighted, what do you mean?
So because
How are you using that term in this case?
So, and that information is up here because
Oh, I see.
we allowed respondents to answer at least 3 responses.
Weighted in that sense.
Yes,
Yeah.
we had to weight the responses so that they were equally distributed.
Mhm. Okay, thank you.
Sure.
Can you give that quick demo, Melissa? I think that would be beneficial.
Sure. So as we were talking about before, I'll just go to, I'm in question 3. All right. So we're in question 3 and I've already shown you can look at Suffolk County in a silo. You can unfilter that and look at everything together. This is how you kind of drill down into the information. So right now we're looking at Hispanic Latino, but if we wanted to look at the groups of people that made let's say 50 to 74,000, you would click that button and all of this information updates to show you that population. So if I'm in this column and I go down to the bottom, I can see that 119 people in Nassau, Queens, and Suffolk made between 50 and 74.9. And then these are the responses. So for cultural and religious beliefs, the weighted total would be 2.75. And I can kind of scroll through to see where the largest group is. So when I look at that population, they're telling me there are no barriers for that. Excuse me, for that income bracket. I can see that they're also 17.25 as a weighted total, say they're unable to pay co-pays deductibles. And that is how you would use the slicers to be able to tell you. And as you scroll down, you'll be able to see which ones are available. You can check and see, I only want to look at people that currently have health insurance or people that don't. So if I click no, they don't have health insurance. It looks like there's only 4 people in that income bracket that do not have insurance that were respondents. But if I unclick that household income bracket, 59 people in all of those counties responded. And so these are the answers for those that do not have insurance. And let's look at their barriers. Their barriers say no insurance, but they also say unable to pay co-pays deductibles. There are no barriers, which is interesting. And they say language barrier or lack of availability doctors. And that is how we would use these slicers to be able to answer your information. You can look at education, you can look at what their current employment is, their annual household income, whether or not they're male, female, etc. And then we can drill into their counties and their ethnicity. And those are the current choices. And they're presented by town and zip code, giving a count of the respondents and then the weighted total for each of the responses to the particular question.
And going back to sample size, unfortunately, yes, this is a convenient sample, and that's why all through the year we we depend on our partners, the hospitals, the CBOs, anyone who could possibly push this out if they happen to have an event. We have paper copies. You can send those to us, and we will data entry those responses on paper copies, because some people still like to fill out paper copies. So we've done that in the past. So of course it would be great if we could have a random sample, but we're not, you know, financially that's not feasible. It's very, very expensive to do. And I think all of you know how difficult it is to get people to fill out surveys. It's just not. And the fact that we got nearly 1,000 is a much larger number than we've had in the past couple of years. Many years ago, we had much greater response, but that was pre-COVID. And I think there were more in-person meetings and more of an ability to hand paper surveys out that people would complete. But believe it or not, this response this year is pretty darn good.
I just see a question, excuse me, in the chat.
Yeah.
Melissa, could you go over quickly how to access the raw data again?
Sure, not a problem. So if you right click on any of these worksheets here below, if you right click, there's a little hide and unhide. If you select unhide all data, everything is in here. If you look at the individual questions, just the responses for those questions are in here, and you will see my calculations to the right of this data. I do believe that, yeah, the headers for all of the calculations are in red, so you'll be able to tell what the calculations are for each of those. Because of the way that SurveyMonkey sends us back the data, you'll see that it's not up and down data, it's across data. So this is one respondent's record for question 1. And so question 1, respondent 1 here answered heart disease, stroke, and then they answered child health and wellness. And they also said mental health, depression, suicide. And so that's how we, they answered 3, which is the count of the ones that they answered. And then we assign the weight. And then we give them a score for those. And that is how we calculate that weighted total. And then this is their demographic information, which I pull right from the all data tab.
Does that answer your question, Gabriella?
Yes, thank you.
Sure. And if you have other questions, you can absolutely always reach out to Janine and Brooke, and I will be happy to respond to them and provide answers.
Yeah, it's interesting. It doesn't seem like mental health is.
Yeah, it really didn't. So when I look at,
which is very, very surprising to me.
It is. So when I look at, you know, the top ranks, the only time we see mental health show up is when we're looking for what are the things that are most needed to improve the community, and it shows up there as 3rd rank.
Yeah. That probably has something to do with access to providers or capacity of providers.
Right.
And providers taking insurance and all of that.
And Suffolk is a little bit different. There's that it shows up more in Suffolk County in the top ranks. It is 2nd for the ongoing concerns in the community and 3rd for ongoing health concerns for yourself. You know, and I do recognize that this being a random sample is not completely indicative of your entire population, but I always like to tell people that these are real humans living in your communities that are experiencing these things. And so I know that our first impulse is to say, well, it's not indicative of the entire population, but these are still humans experiencing these things.
Yes, and this is only one data source that we're using, right? So we also are still, and we'll talk about this as we move along in the slides, we're also in the process of conducting key informant interviews with community-based organization leaders. And then, of course, you're going to look at secondary data from a variety of sources that you usually draw from. Your state has lots of data sets, you know, county health rankings, social vulnerability index, CDC places. If the data is still up there, I don't even remember. A lot of it was pulled down for a while. Is it back up there now, as far as you know, Melissa, a lot of it?
A lot of it is, yeah,
Okay.
they're putting things back up, you know, like the social vulnerability index, they took it down. I was very worried. I had a copy of it, but they did put it back up.
They put it back up.
Yep, but
Right.
I will tell you that a lot of the federal sources like CDC places, they are beginning to remove certain data elements. So you're not going to be able to get new data on things that are split by race or ethnicity. You're not going to get anything with SOGI data that is used to be federally supplied. Those things are disappearing and they're disappearing fast.
That's due to the DEI
Yes.
directives. Yeah. Okay, so that's just something to keep in mind as you go through each hospital and the counties go through and start looking at some of that secondary data. Of course, there's state level, you can look at county level, state level, BRFIS data. There's lots out there. And that all combined together will help us to determine as a region what the priorities should be, or what's the top priority collectively we should work on. And then of course, and remember, you have to choose 3 this year. And then of course, you're free to choose as many as you want. I was just gonna say something else.
Can I ask a question, Melissa? So
Sure.
this is Doreen Bajwa. Hi, everyone. So
Hi.
I'm from a community-based, I represent Cornell Cooperative Extension. We work with a lot of vulnerable populations. So I'm wondering that, you know, the people who were answering, do you have some kind of demographic of the level where they were, you know, the people who were answering these surveys, and what did they represent? So if they were like at mid-level or top-level management, so they're representing the organization, or they were regular, you know, civilians, people on the ground. So that would show you the variability of the data or the variables that came up or came down.
Sure. So this community health assessment survey is not for your community-based organizations. This one is directed towards the general public.
We do have one that we also send to community-based organizations. I think we shared that data already, Brooke, because
Yep, and that analysis is also available on the page that I dropped in the chat there.
right. And are we planning to do like a phase 2 analysis?
So we're going to talk about this a little bit later, but so we're going to have the qualitative analysis of the interviews that we conducted with community leaders, in addition to the survey data we collected.
Yeah. So there's also that as well.
So no, we do not capture, you know, like management or, you know, occupation in the community survey. Any other questions from Melissa while she is still with us, just because I know her time is precious.
I have a question. This is Selena. Are we going to perhaps look at any of the 2025 surveys before, you know, coming together and making the decision, perhaps the first quarter or, you know, half of the year? Just because I think that since we did change the survey, it might change the results.
That again would be a financial question and a contracting issue, because we used to do it twice a year when there was funding available through the state to analyze the data. And then once the council absorbed that cost, we went to once a year. That's why I'm saying we are going to deploy the community-based organization survey. Again, aren't we at the next poverty simulation or something, I thought? And we can certainly ourselves analyze that, because that's easy enough to do. It's not as involved as this.
I was just going to say we could certainly provide preliminary charts just generated from SurveyMonkey, but no, Melissa's, you know, Power Pivot would probably not be available.
Right.
I think if we had the raw data, we could also do it.
Okay, but I don't know of Melissa even pulling in the raw data, like you're only gonna do this one time for the fee we pay you, right?
Right, but Brooke has
We can
ability to
export
pull
it.
the raw data.
Okay.
Right, just
So-
right straight from SurveyMonkey.
Right, so if they wanted to mimic my model, they could potentially do that if they're careful where they put the results. They would be able to add that data to the model if they were familiar with data analysis and the way that the Power Pivot tables work. They could certainly do that themselves.
Okay,
All right, thank you.
all right, so that's helpful. Yeah, I mean, we're a little bit limited, as everyone always is, in terms of funding and all of that good stuff. And so what we've been able to do through the years since the grant ended in 2020 is continue to at least offer something to everyone at no cost. And this is the best that we've been able to do.
And it's great, Janine. I was just curious.
I know you. I mean, I know more data is always
Totally
better.
appreciate all that you guys do.
Yeah, no, I know. I wish we could. Yeah, I know.
I wish I could do it for free for you.
I don't want to say anything
That-
else.
That
Get
is a great
myself in
point, though.
trouble here.
And we can definitely, you know, and we'll talk about this in a little bit. Just we can have a preliminary report on the 2025 data at our next CHNA work group meeting.
Yeah.
But any other questions for Melissa specifically about the 2024 analysis before we let her go? All right, well, that was excellent as always, Melissa. Thank you so much for
Thank
sharing
you
your
so
time
much.
here.
Thank you all so much. Have a great day.
All right, take care.
Bye-bye.
And of course, if you guys do have any other questions that come to mind, please send them to me, Janine, Hannah, and we'll make sure to get an answer for you from Melissa. All right. Can you see my screen again?
Yeah.
Okay. All right. So that brings us to our next slide here. And so for our member spotlight today, we are spotlighting the Nassau-Suffolk Hospital Council, which, as many of you know, the council does oversee the Long Island Health Collaborative and our work. So the Nassau-Suffolk Hospital Council, through several different grant-funded programs, provides free Medicaid enrollment assistance to eligible populations, specifically the aged, blind, and disabled populations here on Long Island. And the NSHC is also an agency of certified community health advocates, and they are available to help any Long Islanders navigate, you know, and understand and use their health insurance coverage. So as you all might know, after the height of COVID in 2023, when the public health emergency came to an end, so did automatic Medicaid re-enrollment that was temporarily in place to ensure that New Yorkers didn't lose their coverage during the pandemic. So an organization, the Community Service Society, put out an RFP for a grant that would fund an awareness campaign to inform New Yorkers about the end of the health emergency, to ensure that they, you know, re-enrolled in their Medicaid so they wouldn't lose coverage. And the council successfully applied and received funding to create and promote what we've come to call Keep Long Island Covered, our awareness campaign that was originally about the end of automatic Medicaid re-enrollment. And we are really excited to report that we have been awarded a second round of funding from the Community Service Society to continue this Keep Long Island Covered campaign. And we just wanted to call that out to you all and let you know it's really kind of launching in full swing now. You might see some of our transit ads at Long Island Railroad stations and at on buses throughout Nassau and Suffolk County. So as you might remember from the last round of this funding, we were you know, distributing flyers, and we do have flyers available for download and distribution on our website. If this is something that you would want to spread the word about to your clients. And we always have materials here at our office available for pickup if you'd be interested in having us print them for you. Anything you want to add to that, Janine?
No, you covered it from A to Z. It's good job.
And if you have any questions about these services, please feel free to reach out to us and we can answer any questions you might have.
Okay.
Our next update.
Our next update kind of aligns with what we were just talking about. So this is the CHNA, CHA work group that's been meeting, I believe, since like last October, November, each month. And this is the group that basically represents all of the hospitals, 2 county health departments, and there's some CBO representation as well. That will come together after having reviewed all the results. We saw the results of the individual survey today. We will look at that as a group, and I don't know if we're scheduled for next meeting or the meeting after, but probably the meeting.
It's this coming meeting where we're going to be discussing the
Monthly meeting,
priorities.
okay. And based upon all of that, we'll come together and decide collectively what are the top 3 priorities. And again, you know, the prevention agenda has changed its framework somewhat. It has those 5 domains on the left, social determinant of health domains, that mirror what is on Healthy People 2030, the federal kind of prevention agenda, if you will. And then on the right side, what's in purple are the themed buckets, I call them, and underneath are the individual interventions.
Priorities, right?
I'm sorry, the priorities, the individual priorities, which some are just kind of broad. It just says poverty, it just says education, whatever it says. I can't even read it here, it's too small. But anyway, there's 24 of them and you're to select 3 of those. The state has completed, they had work groups in place that were helping to define objectives and metrics, measures and targets and sample interventions. And that work has concluded. And on the site now is the new work plan template that each entity will use to complete. And in there, that's where you'll list interventions. There's drop downs for the objectives. Last I looked at it, it wasn't, I don't think they had all objectives in there. Can you open it? Can you get to it and open it?
Can you all see the webpage right now? Okay. So you
Yeah,
should be able to see this file as I open it.
Yeah. But they do not have the sample interventions yet. And they will not have an updated dashboard that mirrors the new prevention agenda framework until like September, like fall. But at least you do have this. So those of you who may have to submit your community health assessment report because your federal fiscal year might end in July or September or whatever it might be, now this tool is there. So you can see they have some drop downs. What is that drop down? Is that
there's focus area here, goal.
Focus area. That's
this looks actually different from the one. Oh, I'm so sorry. I clicked on the previous year's.
I was going to say,
template.
we don't have focus.
I was going to say this is not right. I do apologize for that.
It's slightly different, but the point is, it's finally there. It hadn't been there, but we finally got it.
It's opening now. Sorry.
Again, not the interventions yet, and more guidance is supposed to come from the state. So it does look a little bit different. It actually has some color in it, so it's a little nicer to look at.
Have your buckets down here.
Your buckets are down there. The instructions are at the top. And where's one of those drop downs? Which one?
Here's a drop down for priority. So these are all of the priorities under economic stability. And then there's also a drop down for objectives. And yeah, the intervention does not have the drop down just yet.
Yeah, they haven't done that yet. And they talk to representatives from all different types of organizations throughout the state for sample interventions, and hopefully they're supposed to be, they have them coded, an intervention that might be applicable to hospitals, counties, and other healthcare providers. There's going to be a code for that. And then if it's something that's more usable for hospitals, just say have an H next to it. If it's more usable just for the county, you'll have the C next to it and whatnot. So, but that's not been released as far as I know at this point in time.
And they do have a map kind of all of the drop downs on this last tab if you're interested in viewing that as well.
Okay. So my suggestion is it's there now, at least for those of you who do not have to submit until the end of the year, at least go in and play with it and get familiar with it. And I'm going to do the same thing. And what else did I want to say? That's it, right?
Just wanted to mention that when we do meet on April 9th, I'm not sure if Selena is still here, but we will provide kind of that preliminary, data from the 25 survey. So we'll have that for discussion as well.
We'll have that as well, right?
And that's the meeting where we'll be reviewing all of
Okay.
the other primary data together, which will be the CBO survey analysis, the qualitative analysis of the key informant interviews we've been conducting with CBOs, as well as the 25 CHAS and the 24 CHAS that we just went over this morning.
Mhm. Right, and then you take that, we're gonna look at that. I mean, we used to be able to pull in Sparks data when we had funding, which was always very helpful in helping us determine areas of need, because we were looking at utilization data, but we're not able to do that, and we weren't able to do that last time around either, but we have to work with what we have.
And just as a reminder, we are still conducting those key informant interviews with community-based organization reps through the end of this month. I know there are only a few more days left, but if you, and firstly, thank you to everyone who has participated. We know that you're all so busy, so it's really, we're very grateful that you took the time to meet with us. For those of you who did, if you have not and you would be willing to participate in a brief interview, it's 3 open-ended questions about the health needs of the folks you serve. Nobody knows those better than you, so we would love to hear from you. If you would be able to scan that QR code and schedule a date to meet with us, that would be wonderful. And please feel free to share this with any partners that you might, that might be interested in participating.
Serene, are you still on? Are you interested?
They are anonymous, so don't feel free to answer.
Yes, absolutely. Yes,
You
yes.
are interested.
Yes.
And I do think that when we analyze this, Brooke, are we not indicating what sector?
Sector,
How
yes.
many % from each sector? So the food and nutrition sector, housing sector, we do our best to try and go as broadly as we possibly can. But again, it's difficult. Everybody's busy. I think everybody has survey fatigue. That's why we only have 3 questions, and we try to get this done in less than a half an hour, which most often we do. So the more individuals, CBO leaders that participate, of course, the better will be the data that we receive and that we can analyze. So just keep that in mind if you have not already participated. And if you have, again, as Brooke said, thank you so much for participating. Okay.
Right. Okay, that brings us to our next update, which is all about the core clusters, which, as you'll recall, these are the 3 focus areas. When we started these subgroups back at the beginning of 2024, these were the priorities that we all kind of collectively chose for our group's focus. The idea for each of these groups was to meet monthly or on a regular basis and hopefully produce a final product that met a specific health-related need here on Long Island, that we all, felt strongly about within the groups. So really we had folks from all sectors participating in these groups, and that we've really ultimately ended up producing something for each group that everyone can take collective credit for. So we could not have done that without the participation and expertise of every cluster's participants. So just thank you to you all for making these projects possible. And now we're just going to take a moment to kind of go through what each group ultimately accomplished. So we'll start with the cultural competency and health literacy focused cluster. So the final product of that group was a free 1-hour static training module, all about kind of just the foundations and basics of cultural competency and health literacy. So this is now available on the Long Island Health Collaborative website for anyone to take. it's really specifically aimed at, you know, community-based representatives, you know, folks who do interface with the community, just to provide the basics of cultural competency and health literacy, but it's really open to anyone who would be interested in learning more.
Brooke, you want to go open the link?
Oh, sure. So if this loads,
If
you'll
it
be able to
works.
see. Yeah. So, and all of these final products, they're all available under Healthy Resources on the website. So here's the CCHL 101 tab. And we have a lovely acknowledgement for all of our incredible work group members here who participated. And so you just fill out this form here and you can take the module, which is really just watching the video. And then there is a really brief post-training assessment that you take. And then we provide you with a certificate of completion once you do that within a week. So.
And this is live just like very recently. And we've already had individuals taking the training. We haven't even publicized it yet. So that's a good sign.
That's a good point to make about all of these initiatives. Yeah, so the next step for these is really a promotional campaign for all three of these final products, and we will be working on that in the coming months. So to anyone who has taken it already, thank you so much. We appreciate that, and hopefully we'll have more folks take it. All right, so that's the CCHL. Our next cluster was focused on mental health, and this really was one of the most technical final products that we had worked on. And so the issue that we had identified in this group was the mental health workforce and, you know, accessibility to those providers. And so what we wanted to do was create a resource that, you know, informed folks about the wide scope of careers and career paths that exist within mental, behavioral, and cognitive health care. So this is what we're calling a workforce development guide that resides on the collaborative website. You can see the different chapters here, and I will click just so we can take a quick look. And so it's clickable up here. You can navigate to the different chapters from those buttons. And yeah, you can see all the different chapters and the information that we provide here. And once again, this a guide like this would not have been possible without the expertise of the cluster participants. You know, we can build a web page, but I certainly had no clue, you know, about all of the different certifications and licensure requirements, you know, when it comes to these careers. So I just want to thank everyone who contributed to this.
And this particular, that's okay, this particular page goes into great detail, right, about, you know, more so than what would be the obvious positions available in the realm of behavioral health. And I think it's got everything. It's got salaries, the certifications, as Brooke had said. There's even, I think, listing for where you can get the degrees in training. It's broken
specifically on Long Island, yes.
Yeah, on Long Island. Also organizations for additional support. I think professional organizations I saw listed on there, or was that another site that I saw?
Yep, we do talk about gaining experience, and I think that's where we talk about professional organizations, but that is certainly in this guide, yes.
Yeah, I mean, it's very, very well done. So thank you to all the collaborative members who worked on this. Really comprehensive.
All right.
And last but not least,
the chronic disease focused cluster. We wanted to develop a resource guide for a specific population, and that is young adults managing a chronic condition as they kind of move into adulthood and managing their own healthcare. So that is also in the form of a web page that lives on the collaborative website. You can see the topics covered there. And once again, you have this clickable menu at the top where, you know, readers can navigate to the different areas. So each section is really kind of, you know, an informational paragraph, and then it has a drop-down list of helpful links that are related to each chapter, if you will. So we talk about, you know, lifestyle and prevention. provide some great resources for, employing what we're talking about in folks' individual lives. And I think one of the best sections we have here is about health insurance coverage and how folks can navigate that as they, are moving from maybe their parents' health insurance, or maybe they don't have insurance, and how that they can, obtain health insurance, because as we know, that is a barrier to care for a lot of folks. And we want to make sure that, especially someone who might have a chronic condition, that they are covered. So yeah, that is the.
And again, on the right side, you saw the partners who helped us out to develop this. So that was 3 major projects that took place throughout 2024, with the goal of early 2025 having a work product to show. So I just want to take a moment here to commend Brooke, who really was the driver behind all of this. Think about all the meetings, the follow-up, the fact that she's able to place and build these web pages is a great plus to us, that we have somebody in-house who can do that. She was assisted by Hannah Moore, who's also on my staff, but tremendous job. Everyone knows how difficult it is, right, to bring groups together, and it's wonderful to have meetings, but to actually have a work product that you can take credit for is fantastic. And that's always my goal, is that we have something tangible at the end. And that's really, really, Brooke really drove this whole thing. So I just have to commend her for that.
I just have to say, it really, the expertise of you all is really
Yes.
where the content came from. So I want to reiterate that. And I do
Yes,
just want to reiterate
absolutely, yes.
my
but-
gratitude to Hannah, because she really helped out a lot with
And
these.
gratitude to Hannah, but you know what, you got to keep the train on the rails, right? And that's a skill in and of itself. Anybody who's ever run any kind of coalitions, and Hannah's done this in her previous job, ran a coalition. It's difficult to get everybody on the same page and working and agreeing to finally come out with something like this. And believe it or not, 12 months wasn't really a long time to come up with some, to come to a final product like this, but they did it. They all did it. So fantastic.
So thank you all for that. All right, and now that our clusters have concluded, on to the next.
Now we have another project that we're working on. And of course, Hannah and Brooke jump in on this if I don't explain it as well as I perhaps should. But this project, we decided, now that the collaborative has been in place over a decade, we thought, we want to think of some kind of a research study or something, some research project that we could do. And we all talked about it. And I think it was at the last collaborative meeting where we actually took a vote on what we thought was feasible for us to do, with the end goal of getting this article or case study, whatever you want to call it, published in a peer-reviewed journal, for which the group would take collective ownership. And that's what we decided to do, and that's what we're going to be doing for 2025, with the goal by the end of 2025 having that article published. And there's a whole host of successes and processes and procedures that we have been following and have put in place at the collaborative over the past 10, 12 years, and have enough now, I think, that we can report on and talk about how to sustain a multi-sector coalition like ours, with now no funding, by the way, and keep everyone interested along all these many years. So that's what's percolating right now. Did I get that right, guys?
Yeah, I don't think you missed really anything there. Just that we are going to be forming a
Yeah.
subgroup, similar to, our clusters that meet on a somewhat regular cadence, to be determined by the group participants. So we did just want to survey everyone at this meeting here, and we will be sending out a communication to the greater collaborative to, invite folks to participate. But if you are interested in signing up for the subgroup, if you would, please fill out this pop-up poll here. It's just with your, your name, title, organization, and your email address for the distribution list. And then, once we get, survey the rest of the group and see who'd like to participate, then we'll send out an initial email to ask about availability and when we can get our first meeting on the calendar.
And I know that we have had interest from among several members already. I know Linda Mermelstein wanted to, or Stein, I always say your name wrong. I know Tavora was interested. I know Sue McCabe was interested. But we're formally taking names now. So even if you've told us, and it's not that we don't remember, we do remember. If I forgot anyone who already said yes, I apologize, but we are aware that we've already had individuals who said they absolutely would want to be involved in this particular subgroup.
Thank you for reiterating that, because you're right. Folks definitely have expressed their interest and commitment. So thank you for documenting it formally here.
And we did not forget about it. It's just we want to document it now.
So I'll leave this open for just another few seconds here.
And the other clusters, Brooke, they were meeting every other month, basically, I think, or in between the collaborative meetings, right? Wasn't that?
Yeah, we started with monthly and then we went to bi-monthly. So I think it's really, the cadence is probably something we can determine as a group.
Yeah. And Hannah, you have already investigated some journals where we might be able to submit.
Yeah, it was a long time ago when we were first thinking about the idea of it. So I would have to go back and refresh which ones that would be. But yep, we do think that it's absolutely possible to get this into a journal, especially about collective action and coalition work. And
all right, so thank you to everyone who has signed up here. I am just going to close this out. I think I'll just leave it open for 15 more seconds. So it's been 2 minutes and 30 seconds. But if you, didn't get a chance to fill this out and you decide later that you want to join, please don't hesitate to reach out to us via email and we'll add you to the distribution list. So thank you all who expressed interest here and signed up. All right. So our next update, which we talked about a little bit already, is continued promotion of the Community Health Assessment Survey.
Which, as I say all the time, and you're probably tired of hearing me say it, data out is only as good as data in. And so the more surveys that we can get into the hands of individuals to complete the surveys, the better it is for us on the other end when we analyze, because then we have a greater number of responses, which you all know makes for richer data. So I always implore everyone to please keep that in mind. Distribute the surveys. We have a social media kit that you can pull from, and that's that's in a Google Drive. Is that not correct? Or am I?
It is in the Google Drive, and I will just say, no, you know what? It is completely in date, because the survey links have not changed at all, even though we updated the CHAS. So yes, that is still accessible.
Right. So that's there. We try to make it as easy as possible. When we post, and of course, if you're not following us, please do. That's a important step to take. But when we post, please just repost it, right? That's probably the easiest way to go about it. Repost it with a comment or two. Long Island needs to hear from you. Please take this quick survey or whatever it is. But that's the easiest step that you can take to help circulate that survey.
Absolutely. All right, and just some other reminders. Of course, Collaborative Communications goes out every other Monday. That's our newsletter full of member resources, jobs, events, things like that. So any items for inclusion, please send them to us directly. You can send them to like@nshc.org, or you can send them to me. And we also have a link there to subscribe if you're not already on the list. We also have our free event calendar on the collaborative website where you can submit your events to be posted there. And we also have our Walk with a Doc and Walk Safe with a Doc events that we are always, willing to partner with anyone who'd be interested in bringing one of those events to their organization. Just as a quick kind of reminder, Walk with a Doc is a national evidence-based program that was started by a physician in Ohio who said, why don't I just, walk the walk instead of just telling my patients to go on a walk? So we have a chapter here on Long Island, and we do have some events coming up here. So in partnership with the New York Coalition for Transportation Safety, we do these Walk Safe with a Doc events that we do them usually in a downtown area, and we have our pedestrian safety expert provide tips for pedestrian safety along with health education from our lead physicians that lead the walks. So we'd love to see you either in Garden City or Franklin Square if you can join us. But this also gives you a sense of what, the promotional materials look like and what we'd be able to partner with you on if you'd be interested in having such an event.
Right, and we pretty much, other than the hospital or the CBO organization or whomever it might be, the county having to secure the physician, and sometimes it's a nurse practitioner, but most of the time it really should be a physician. We do everything, right? The promotion, setting up the registration, everything, correct, Brooke?
Yep, and if you are a community-based organization, and we can certainly pull from our hospital partners to provide the lead physician to give the talk and walk with attendees.
Right, and it's a great opportunity for our hospital partners as well because it is an evidence-based program. Of course, the walks are in different spots throughout Long Island and might not exactly fall in your patient service area, but nonetheless, these walks do take place, and we do if I can remember, I know we do surveys to find out about, if there's been a enhancement in knowledge about chronic disease and safety, at least for the Walk Safe with the Docs. We talk a little bit about chronic disease and a little bit about what do you know about pedestrian safety. I might be getting that wrong. I'm always getting it confused with the
That's
other
right.
one. Am I right?
That's exactly right.
Yeah. So that's data that we also have available that you can take a look at. And that is on our walksafeLongIsland.org site, correct?
It is, but I do believe it's also on the data resources page where all of the CHAS data is housed. So it is all in one place for you there.
And you can also pull from that as another primary data source if you wanted to. And we basically chase people down at these walks. Please fill out this survey before you go on the walk. And when you're done, please fill it out and let it so we can see if there's been a change in knowledge. So we really do. We were really grassroots on the ground, doing the best we can to get as much data pulled in as we possibly can. Basically with just pretty much Brooke and I, and Hannah sometimes goes to these, but just basically Brooke and I when we go to these events. So.
And we are excited to announce that, as you might remember, pre-COVID, we did have, a monthly Walk with a Doc event, and we are bringing that back now that we are past COVID, thank goodness. So on the first Thursday of every month at 6 p.m., we are going to be walking with Dr. Keisha Guerrier at Blydenburg County Park in Smithtown. We're really excited to kind of get back into a regular cadence and hopefully build back up our core group of walkers who will join us every month for a walk in the park. Dr. Guerrier, as you might recall, was our first Community Champion Award recipient, and we're very grateful to her for agreeing to lead these walks. Our first one is going to be on June 5th at 6 o'clock, and we would love to see you there. Something new that we're trying, we are going to be having a virtual component to these walks. So, if maybe you can't make it to the park, but you want to hear what Dr. Guerrier has to say and you want to walk maybe on your street, but walk with us virtually, we'd love to have you join via Zoom, and we would love to have you there in person as well. So, and this is a part of our kind of partnership with ARP Long Island. They are going to be promoting and co-promoting these walks for us, as well as the other offerings of our other Long Island Walk with a Doc chapters. And you can learn more about that on our Walk with a Doc page of our website if you're interested in their events as well.
Hopefully we see you all at Blydenburg County Park.
We would love to.
Yes, we would love to see you.
And Hannah, I don't know if you want to speak to this. You're really taking the lead on the poverty simulation. So
sure, yeah. So this you might remember from last summer. I went to an event that was hosted by Nassau County Department of Health, the Office of Minority Health, or I might be confusing the two, but so they hosted this in partnership with the New York Institute of Technology, and it's an immersive experience trying to portray the barriers faced by our low-income families and people living in poverty on Long Island, and sort of the everyday barriers to getting healthcare and just even completing daily tasks. You're assigned a character, and then you have a task that day. Either you're going to work, or you have to get X amount of tasks done, and all within the context of being low income. It's a really great experience, so much so that after I went, I kind of came back, reported back to Janine and Brooke about this. We ended up hosting a fall event in partnership with Nassau County Department of Health, Suffolk County Department of Health, Nassau Community College. Choice for All is the one who actually owns the license for the activity. This time around, because that activity was actually in Nassau County and it was at Nassau County Community College, kind of in an obscure location. I know a lot of people kind of came in and were like, I almost didn't find it, I almost didn't make it. And I think some people even tried to get there and couldn't. So we're trying to make this another opportunity for our members to participate in the activity. This is going to be hosted at Western Suffolk BOCES. Karen Kirschbaum, thank you so much for being kind of our point of contact and bringing this to fruition. So we're really excited about it. It's going to be on Tuesday, April 29th. It is kind of an all-morning activity. It starts the doors will open at 8:30. We'll have breakfast, you can network, and then the activity really starts I believe around 9:30, and then concludes around 12:15. So it is kind of an all morning activity, and it is, I know we recognize that as kind of a barrier to getting people there, but I think now more than ever, and I was thinking about this as Melissa was kind of explaining how data sources are kind of being culled, and I think this is just important now more than ever. It really is just a really eye-opening experience. And I think it's a great way to bring together so many different sectors and community-based organizations, and hopefully just a refresher that, you know, we're all in this together. As Brooke and I have navigated a lot of these community health needs assessment CBO interviews, we've kind of heard that sort of hopelessness and fear. So I think this kind of will be a really great way to hopefully reinvigorate our partners, and yeah, just remember that we're all taking this a day at a time and doing what we can. The last time we did host this, we had a really awesome suggestion that legislators and lawmakers be a part of this. So we're hopefully trying to push this out to individuals who are more on that decision-making side, especially policy. So if you have any connections with your local legislators or lawmakers, decision makers of your own organization, I think that's a really important demographic to get involved in this activity. But of course, anyone is welcome to this. We're really excited to host this. And again, thank you so much, Karen.
And I will just drop the link in the chat here. Sorry for the delay on that, but
yeah, it's a really eye-opening event. And of course, the idea is to have those key decision makers, the individuals who might not be grassroots working on the ground there, so because sometimes you get a couple of steps removed from people's actual experience, to get them there so that they can immerse themselves, just as it says, immerse themselves in what many of these individuals have to face on a daily basis.
So we're really looking forward to that.
Yeah. So we hope that you'll all, if you didn't attend the one in Nassau, or if you'd like to go again, we hope you all will be there. We will have some refreshments in the morning, so.
Yes. And just one more event that we want to bring to your attention. As you know, we work with the New York Coalition for Transportation Safety to deliver that pedestrian safety education to Long Islanders through our Walk Safe Long Island campaign. Part of that campaign is this annual Walk Bike Long Island Summit that we've been doing. This is our third annual event held in partnership with Nassau University Medical Center, who's graciously offered to host us for the second year in a row. So this year's event is all about advocacy and action. That's going to be our focus and the focus of our panel of speakers. As you can see, we have some really great speakers lined up this year. The Commissioner of the Garden City Police Department, the former Director of Strategic Initiatives for the New York City Department of Transportation, and a really, really interesting speaker that we've secured for this year. His name is Jonathan Prevost, and he is a Baldwin native who has accomplished a great deal, in his community as far as roadway improvements through advocacy. So we are really excited for this year's event. And if you have a personal or professional interest in this topic, in improving pedestrian and bike safety on Long Island, we would love for you to join us. So
And then if you're wondering why we do so much work with the New York Coalition for Transportation Safety, it is because we are they have subcontracted with us to do lots of their event planning and marketing and communications through a grant that they have. So
thank you for connecting those dots,
so
Janine.
I don't want you to think we're favoring them. It's just that they're paying us so to help them do this. And they do really great work. Unfortunately, I just saw a Newsday article about how terrible Long Island's roads are and the crashes and deaths and injuries. So as much as we try, it's an ongoing problem. So we can't take our foot off the pedal, no pun intended.
All right, and then just our, the rest of our meetings for 2025, those links are up on our website for you to register and get them on your calendar now. And we hope to see you at our next meeting on June 26th via Zoom.
Right, or see you at one of the events before then.
Yeah, that would be great. Right. So it's 11:02. I know some folks had to drop off for some other meetings. Any other comments or questions anyone might have? Well, as always, thank you all for your time.
Yes, thank you. It looks like everybody's happy to get a half hour back, which is wonderful. We covered a lot of ground in an hour and a half, so I think we can say goodbye.
All right, thank you.
Thank you.
Thank you, everyone.
Bye-bye.
Have a great day.
You too.